Hello, good afternoon, and welcome to our webinar. I hope that your Thursday is going well. It looks like a number of people are still getting logged on, so we're going to give everybody a minute to finish getting their audio all set up. So thanks for joining us, and get settled in, and we'll be right back with you in a minute here. We're excited to share our NextGen add-on solution, ChartGuard, with you today. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for iTen. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with iTen, I wanted to share a bit of who we are with you. We specialize specifically in NextGen Healthcare. We're good at getting data into, out of, around, and through NextGen. Basically, our goal in life is to make delighted clients by helping them get the absolute most out of their NextGen software investment. We're passionate about providing solutions for healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. And we also have an add-on productivity solution on top of ChartGuard, which is Refund Manager. Next, I wanted to mention some upcoming educational webinars that we'll be presenting soon. Next week, we'll be talking about NextGen 5.9.1 and 8.4.1 from a beta perspective. This one is super popular, and in it, we're going to examine the upgrade from a client's perspective, explore new features in EHR and PM along with some specialty-specific ones, and also cover some issues we encounter in hopes to help you avoid them. Then on July 11th, we'll be presenting Transforming Patient Access to Healthcare Using Telemedicine. For information on those and to register, head to the Events and Education page on our website. Okay, so back to ChartGuard. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Tom Seco is iTen's Business Development Manager, and Joel Schultz is Director of Product Solutions at iTen, which means that he and his team are the ones that actually build this great program. So Tom, I'm going to go ahead and pass it off to you. Feel free to get started when you're ready.
Okay, thank you very much, Chelsea. And again, thank you for attending our webinar about ChartGuard and Downtime solution for it. So here's the agenda that we're going to cover today. One is you're going to learn about what ChartGuard is. We'll talk about EHR dependencies, and you'll learn why practices buy ChartGuard. We'll also tell you how it works, and I'll show you the ChartGuard output, and then give you a brief overview of who iTen is, and then we'll be able to answer any questions that you have as well. So what is ChartGuard? Well, ChartGuard is a business continuity solution, and it ensures the availability of your patient charts during downtime situations with your EHR system. So it really addresses the downtime preparedness at each of the clinic locations that you have. There is a regulation within HIPAA that says that you should establish and implement as needed policies and procedures for responding to an emergency or other occurrence that damages systems that contain electronic protected health information. So this is one of the reasons why people buy ChartGuard, is to address this particular clause in HIPAA. The other instance as to why people purchase ChartGuard or a downtime solution like ChartGuard is because we become so dependent on EHR. And with that dependency that we have EHR, the systems have become more and more complex over time. You know, we have servers, we have workstations, we have tablets, we have scanners, we have local area networks, we have T1 lines, we have wireless routers, we have VPNs, we have internet connections, hosting connections, power systems, cooling systems. You know, all these components have come together to create our EHR systems and support them. Each one of these components has hardware associated with it as well as software. So as we continue to add these components, and as we continue to add the software to components, the chances for one of those components to have a bug in it, to have a problem with it, to go down, increases as well. And when we lose access to our EHR system, what kind of an impact does it have on us? Well, it can impact the quality of care. We can lose productivity. We can lose revenue. And there have been some studies that have been done over the years with regards to what downtime can cost an organization. And a couple of those studies have shown that it can cost as much as $488 per hour per provider. So it can be quite expensive when the system goes down and you lose access to your EPM system, your EHR system. So when we lose access to our EHR system, what options do we have? Well, we could close the practice and location and send all the patients home, don't have them come in. We could go to paper charts, but that's becoming harder and harder for us to do because we're becoming more and more dependent on the EHR systems and less dependent on the paper. We could go to redundant technologies and implement, more servers, more networks, more storage area networks, more data centers, more power systems, more cooling systems. But when we start doing that, then our costs begin to exponentially increase as well. So it can be, redundant technologies can be quite expensive initiative. Some organizations have the option of going to hosting, but then that also has its own risk because now you have another connection outside of your office location, outside of your infrastructure that you have to connect to get access to an alternate site. And if you lose access to the internet, how are you going to get to the hosting site if you have to go through the internet to get there? So this slide here is a slide just to remind us of what can cause failures. I won't go into each one of them, but we'll talk about a couple of them. One, the second line there where it says sprinkler line failed. Well, we don't have sprinklers in computer rooms, but what happened in this particular case is there was a sprinkler line outside of the server room, and it started to leak. And when the water started to leak, it started to go into the server room. So the server room had to be shut down. And when they shut down the server room, all the outside connections were lost. In July of 2015, you may remember on the same day in July of 2015, United Airlines, the New York Stock Exchange, the Wall Street Journal, and the Brookings Institute all had failures on that same day. United had had a network connectivity issue, and they had to ground flights for 2 hours worldwide. The New York Stock Exchange had a faulty software upgrade that occurred that caused them to stop trading for nearly 4 hours. The Wall Street Journal's website had a situation where they had not enough capacity to handle the demand that was coming in and caused the server connections to fail. And then the Brookings Institute was offline for an hour due to a content publishing error. If you think about each one of these organizations, they're all built for uptime of 24 hours, 7 days a week, 365 days a year. And if these organizations who are built for that, have infrastructures built for them, for that kind of uptime, and if they can lose access and have issues, cause them to come down, any organization can have an issue that may cause them to come down. In October of 2016, there was a cyber attack on the organization, the company called DIN, and that cyber attack had caused Amazon to come down, Twitter to come down, Pinterest to come down, Athena Healthcare to come down, Pandora to come down. All these organizations came down, and in fact, most of the East Coast could not get access to the internet. Thus, they lost connectivity. And then just a few months ago, Comcast internet service went down for about an hour and a half, and many organizations across the country were affected by this outage. And the outage was caused by a organization that runs the network infrastructure for Comcast called Level 3, and they had a configuration error. So if you look at each one of these failures, they happen because of not only software problems, hardware problems, but they also happen because of human error. So these examples are there just to remind us of what can cause the systems to come down, and most of the time it is out of our control. When if you think about the $488 that I talked about earlier, with a 10 provider practice, if it came down for 4 hours, it would cost as much as $19,520 for that outage. So it can be quite expensive when an outage occurs to the organization, to a healthcare organization. So as you think about the problems that we have when we lose access connectivity to our EHR systems, when we think about the impacts that it can have to our organization, the questions that we need to ask ourselves when we're thinking about these things is one question is, do I pursue uptime, or do I pursue a solution that enables me to continue on with my business until NextGen comes back online? Do I need to pursue uptime? Do I need to add redundancy? Do I need to add more servers? Do I need to add more cooling systems, more hardware, more connections that increase, exponentially increase my costs? Or do I think about coming up with a solution that says, okay, I know my system's going to come down, but I need to keep the business running. What kind of solution out there enables me to keep my business running while I can have, my IT folks work on getting NextGen back online? Another question we need to ask ourselves is, am I going to be reactive, or am I going to be proactive in my clinic's preparedness for downtime situations? Am I going to be reactive, meaning, am I going to wait until I have a downtime situation in order to begin to implement a solution that's going to enable us to continue on with our practice, with our business? Or am I going to say to myself, you know what, all these things are outside of my control. Something may cause me to have an outage. So I'm going to be proactive and prepare our organization to be able to address a downtime situation if and when an outage occurs to us. Another question we can ask ourselves is, what are types of impacts that a NextGen downtime incident can have on our particular clinic? Thinking about the impacts of quality of care, thinking about the impacts of lost productivity, the impacts of lost revenue. What are those impacts to our organization? The impacts vary from organization to organization. The type of impact, or the relative dollar amount impact of each one varies as well. So, what is the significance of that impact when it does occur to us? So we're talking about the types of impact, and we're talking about the significance of the impact and what it does to organizations. So if we were to lose access to NextGen for an hour, what's that going to cost us in terms of productivity? What's that going to cost us in terms of cost, in terms of revenue, in terms of quality of care? What's that going to cost us? And then, really the question isn't whether the clinic or the office location is going to lose connectivity. It's really, how do we minimize the loss? How do we minimize the disruption when it does happen? These are the types of questions that you need to ask yourself when you're thinking about a downtime solution, and downtime as it affects the organization. So, we put together a ChartGuard solution for our NextGen clients, and it came about because a couple of our clients years ago had asked us, just that question: if I have a downtime situation, I don't want to add more hardware, I don't want to add more connectivity, have another backup site. I want to be able to have a solution that I can go to that enables me to continue to see my patients and continue on with my business while I'm trying to get NextGen back up and running. So we came up with ChartGuard. It is an affordable solution. It is one that ensures that the practice, the health center, can continue in a productive and a profitable manner, and be secure while we're having a downtime situation. And the solution that we came up with is be able to take the patient records and have them created as PDF files so that they can be easily read, easily accessible, and the providers and staff can continue to see the patients with the chart information while they are trying to get NextGen back online. So how ChartGuard works, I'm going to turn it over to Joel Schultz, and he's going to talk about how ChartGuard works.
All right, great. Thank you, Tom, and thank you for attending today. When we created ChartGuard 7 years ago now, we sat down with some clients, and these clients lived in areas where they were prone to various outages from weather conditions, whether it be hurricanes coming in or storms or tornadoes or whatever. So they wanted something that would kind of give them the ability to see patients even though their technology infrastructure, some link in that complex chain, had failed. The most common one we see is the network, but again, it could be anywhere. It could be the database servers hung. It could be maybe there was an upgrade over the weekend that's running long into Monday morning, and the patients are starting to show up and you need that clinical information. It could be a variety of different things. So when we sat down and designed ChartGuard, we looked at the various options available about where the data should reside when the practice is having an outage. And the answer we kept coming back to is it really needs to be within the four walls of that location. Because if the database server's down or the network's down, you're not getting to the data. But the only way you can have some reason, some confidence you're going to get to that data is if it's already at the practice. Now, because your network's down or your data center's down, you need a way to access the data that's very straightforward when it's at the practice. So what we did with ChartGuard is we put all the complexity back in the engine in the data center that creates these PDF files that Tom just mentioned. And the PDF file, just think of it as a electronic representation of the paper charts we had several years ago. Okay, so it's going to have their history in there, and it's really just the relevant history that you need for a downtime situation, but it can have the full history. Most clients look for, some recent scope of history in those charts, those PDF files. And of course, you get one per patient, right? Just like a few years ago when we had paper charts, you had one folder per patient. So, that way you're not accidentally browsing too far into the next patient's information. So we're going to go into your NextGen database. We're going to look at the appointment schedule for the next several days. We're going to look at where those appointments are going to be located, and we're going to look at the people that are coming. And from that, we're going to determine which charts we're going to create. Okay, so we're just creating a subset that's needed for that window. The engine's then going to go out to the information in NextGen, and it's going to produce this paper chart. And this paper chart, if you think about the EHR, contains information from your modules and your documents and your ICS, and it aggregates them into this one file that's easy to use. Now, I mentioned at the beginning that we need this to be technologically simple to use because the location that's having the outage just has bare minimums, right? They have electricity, they have some PCs up, but they may not have full access to the cloud. They may not have full access to a database somewhere with an alternate EHR system. So that was the reason early on in the design of this, we decided to use PDF files as the container for each chart. And the main reason for that is almost every computer out there today, every operating system out there today, every tablet out there today has a PDF reader available for it. So if we can get those out to the location, you can use those in a variety of different ways, including dumping them to paper as needed and putting them in a manila folder, just like we did a few years ago. So the engine looks at the appointment schedule, creates the PDF files based on the location of that appointment, copies those PDF files out to a designated network share at each of those locations overnight, and it's doing this for several days in advance worth of appointments. And then those are out there, so at 10 a.m., when a storm rolls through or the construction crew down the street cuts your network line, you have that information out there for the vast majority of your patients coming in already within the four walls of the practice. Okay, so you have that clinical information. You can use it on paper. If the network is up within those four walls, but not to the rest of the world, you could access those charts off that share electronically. So it gives you a variety of different options with what is a technologically simple solution to use when all the complexity has failed you. So that's kind of the gist of how ChartGuard works. Engine creates the charts, that happens overnight, and pushes them out to each of the locations to a designated network share. So it's, very straightforward in its architecture. All the complexity is in the engine's ability to render all that different information from NextGen. So what actually ends up in the chart? Well, each night, each site is going to get their appointment listing because they want to know who's coming in and when. And especially if they're putting those to paper, they want to put them to paper, just kind of on demand as they need them. So that way they can, instead of printing the whole day's worth of charts, if the network comes back up halfway during the day, now you have extra PHI you didn't need sitting out there. So this way you can look at the appointment schedule and say, you know what, let's print these ones out and, just have someone kind of keeping up with people as they check in. So you're going to get a PDF file for each site. That's the appointment listing. And we'll take a look at that sample in a little bit. Inside the chart, as I was starting to mention earlier, you're going to get a patient data sheet. That's just, the basic demographics, patient name, address, who's the guarantor, what their insurance information is, good things like that you need to know when the patient presents at the front desk. On the clinical side, you're going to get a whole host of information that the clinicians are going to need in order to talk to the patient back in the exam room. So it's things like allergies, immunizations, medications, problems, lab orders, vitals. And then in addition to that, there might be some information that is kind of outside of NextGen. And those might be the documents you generated from inside NextGen. Okay, your master IM and notes and things like that you want to pull in the most recent ones of those into the charts when they generate. It might be stuff that you've scanned into ICS or stuff that's come over through interfaces into ICS and you want to pull those into the chart. So all that information that you see here on this slide gets packaged neatly into that PDF file for you to either print out or use electronically. And we'll show you what that looks like in just a minute. So Tom, if you want to jump in and navigate to the samples, then
Okay.
we can take them through what a great solution it is and how easy it is to use.
Okay. So here's a sample of what the appointment listing looks like. You see here that we have the location, we have the provider's name, the date of the appointment, the time of the appointment, and then who's coming in for that particular appointment and what they're coming in for. So this appointment listing is used by the front desk to obviously set everybody's expectations about who's coming in, and they can continue, the whole office can continue to see the patients that are scheduled to come in. This next PDF file I'm showing you now is going to be the chart itself. And this is what the chart looks like as Joe described. So you'll see here in the top of the chart is all the demographic information for the patient. So the patient's name, address, their insurances, both primary and secondary insurances are showing up there. And then as you can scroll down through the file, here is begin to see the data that shows up for that patient. So here's the allergies, for the patient and what that looks like. You can go down to the next page, scroll down to the next page, and then you'll see the active medications for that individual. So the physicians and providers can take a look at the chart and see all the information for that particular patient. Here's the labs and what they look like. Now, rather than scrolling through the information from top to bottom and from bottom to top, you can also, we've bookmarked the PDF file. So if you click on the bookmark, you can then quickly go to the section that you want to find. So if you wanted to look at the immunizations, you click on the bookmark for the immunizations and it takes you right there. If you wanted to go back up to the labs, you go back up to the labs and it brings you there. So the providers and staff have the ability to scroll through from top to bottom or quickly use the bookmarks to get to the section that they want to take a look at that time. So here's a look at what the vitals look like. And then as Joe mentioned, we bring in the various documents and ICS images as well. So here's an example of what the documents look like. And then here's an example of what the ICS images look like. So here's a look at EKG. And then here's a look at, pathology report. So again, the amount of information that can be stored here is we can create the depth. You can control the depth of the information. So you can control it by you want to see all of the images for the past 6 months, or you just want to see the last 3 images. So you can control the depth that way. We also can include the account summary. So if the front desk has a patient come in and they have a balance on their account, they can take a look at the account summary and be able to still collect money based off of that as well. So that's what the appointment listing looks like, which, as Joe mentioned, each office location, each clinic location will get the appointment listing for their particular location. They will also get this is what the chart looks like for the patient, and these charts will be sent to the location that the person is going to present at. So as I mentioned, going back, you can pick the number of days, as Joe mentioned, you can pick the number of days to generate going forward. So you can look forward 3 days, 5 days, how many days forward you want to look. And then the depth of information that I mentioned, you can go back to let me see the labs for the past 6 months, or let me see, just the last lab. The appointment listing can be customized as well. Sometimes you can add, some organizations want to see the phone number on the listing so that they can call patients as well. This is just a testimony of one of our clients that used NextGen. This is about, I'd say about 1.5 years ago. They had purchased ChartGuard, and about 6 months after they purchased it, they had an outage that took out 2 of their largest clinics. And they were writing us this email. The manager was writing this email just letting us know that it worked well, that they didn't have to close any clinics, that they didn't have to turn away any patients, because they had to do that in the past when they lost access to NextGen. Now with ChartGuard, they did not have to do that. and the doctors and providers were pleased with the results of ChartGuard and how it helped them continue to see their patients. This is, ChartGuard. We have created a couple of versions of ChartGuard over the past 2 to 3 years. ChartGuard is the product that we just talked about. Then we have a ChartGuard on-demand version that allows you to create patient charts on request. So if a patient comes into your office and says, "I would like to have my chart," you can go ahead and create that chart, put a request in to create that chart, and 15 minutes later, what happens is ChartGuard on demand wakes up and says, "Hey, do I have any requests for me?" It looks out there and it does see your request. So then ChartGuard on demand goes off and creates the chart, generates the chart, so that you can either print it and give it to the patient if they're still waiting there, or you could take it and put it on a thumb drive and give it to them to walk out with. It's also very good for audit requests as well. So if you have somebody coming in to audit, and they want to take a look at a range of patient information, you can do the particular request with that range of information using ChartGuard. And then ChartGuard archivers used for long-term storage of charts, mainly used if an organization is going to migrate between EHR systems, or if a physician is leaving the practice and they so happen want to bring their patient information with them. ChartGuard archiver is used to extract that information out. So a couple of versions of ChartGuard. Just a little bit about iTen and who we are. We were founded in 2003, and as Chelsea mentioned in the beginning of the presentation, our mission is to create additional value for your NextGen investment. We know that when you purchased NextGen, it was a major purchase, and that investment probably has grown over the years with regards to upgrades, with regards to maybe adding additional hardware. So we want to work with you to get as much value out of that investment as possible. Our passion, as she mentioned as well earlier, is to work with our clients to improve patient care, to work with our clients to enhance the patient experience, and to work with our clients to maintain a financially healthy practice, healthy business. We have 19 plus years of experience with NextGen, and we have 70-some employees in the company, most of which are consultants that travel from practice to practice, health center to health center, working with the organizations to improve workflows, improve business processes, improve the use, and helping you get the most value out of NextGen. If you take the 19 years and the 2003, they do not add up, and the reason for that is iTen started out as the IT department for a medical organization, and back in the late 90s and early 2000s, when the business mantra back then was focus on what you do best and outsource the rest, the medical organization was going to outsource the IT group. And the leaders of the IT group said, well, if you want to do that, what we like to do is form our own company and provide services back to you. So they agreed to do that, and from that point forward, we've worked with over 350, 400 clients that use NextGen, and during this time frame, we have become a strategic partner with NextGen as well. We do have 5 service lines through which we generate our revenue. And within those 5 service lines, we provide these types of solutions. Any solution can be done as a point solution or in combination with one another to provide an integrated solution. So we can do implementations of NextGen. We do process improvements, workflow improvements that I mentioned. We have a group of developers that can provide template enhancements. We can do upgrades to NextGen. We also can provide support for NextGen. We have a group of technology folks that can provide managed services to the IT group, meaning that we can support your desktops, your laptops, your printers, your local area network infrastructure. We have our own data center, so we do host clients out of our data center. And then we have a group of developers that develop the productivity tools of which ChartGuard is one, and ChartGuard's versions are some of those productivity tools, as well as Refund Manager, which is a tool that streamlines and automates the way that you handle credit balances on patient accounts and issue refund checks. Refund Manager makes that process much more efficient. We also have developed an interface to NextGen with Phreesia that allows the individuals in the waiting room when they're on the Phreesia tablet to also update their clinical information. And then we've created a interface to be able to seamlessly move files between TransWorld and NextGen in order to lower the cost of collections. TransWorld's a collections organization, so we work with them to lower the cost of collections with the interface that we created. So at this point, we can take any questions that you have. As Chelsea mentioned, enter them into the questions box there, and we'll answer any questions for you.
Hey, thanks so much, Tom and Joe. Thank you for the demo. Looks like we only have a couple questions, so if you have questions, feel free to type them in, and I'm sure that we'll be able to get to them quickly here. So first question, can I use this product on a specific chart, or does it have to be on everyone's chart? I think they're asking if they can use it for a single patient.
Okay, this is Joe. I'll go ahead and jump in on that one. If you're looking to produce charts for individuals or populations of individuals, the variant of ChartGuard known as ChartGuard On Demand will allow you to do that and do it within a short time period versus having to wait for it overnight. We do have some clients who create kind of a dummy resource in their appointment schedule, and they'll put kind of those extra charts they want to create for ones they're going to hand out to patients in there. But again, you have to wait for it to run overnight and pick up that one when it does the rest of its processing. So ChartGuard On Demand would definitely be the best solution for doing that, for picking patients or even a single patient and generating the chart within a few minutes.
Perfect. Thank you so much, Joe. Next question. Our NextGen is hosted through someone else. Can we still use ChartGuard with it?
The answer is definitely. We'll work with you on how we're going to set up ChartGuard, where it's going to be set up, if it's going to be set up in your hosting provider's data center, or if it's going to be set up across the wire at your main location. So we have a variety of different options on installing ChartGuard. So we'll work with you on the installation. By no means is this here's the EXE, we throw it over the wall and let you fend for yourself. We'll work with you each step of the way to make sure that by the time we're done, you're generating charts and they're getting pushed out to the site.
Perfect. And it looks like this might be our last question. What happens when NextGen upgrades versions?
We keep ChartGuard current with your NextGen version. That's part of our business model and part of the maintenance you pay. So as you're upgrading NextGen, we're also upgrading ChartGuard. And we'll work with you if you want to install ChartGuard in your test environment as you're vetting out a major upgrade of NextGen. But for the smaller upgrades, such as hot fixes, things like that, usually there's no additional work required. But if you're moving between major releases of NextGen like 5.8 to 5.9 or switching major releases of KVM, then again, we'll work with you to set up ChartGuard in your test environment so you can vet out what you're doing actually ends up in the charts.
Okay, well, it looks like that's it. Thank you, everybody, for joining us today. And Joe, thank you for the demonstration. And Tom, thank you for all the information. If you have any follow-up questions, please feel free to reach out to either of the guys. You see their information up on the screen. We're here to help. So if you think of a question later, just let us know. And I hope that we see you at our next webinar. As a reminder, it's next week. It's an educational one on the newest version of NextGen from a beta perspective. So sign up for that on our website.
Thank you, everyone.
Thank you very much.